Alright guys, let's jump into another board review question. Here's the question stem. A 60-year-old female presents to the emergency room with a history of falling onto her right elbow. She cannot raise her right arm. Physical exam reveals loss of sensation over the lateral side of the right upper arm and shoulder. Radiology reveals fracture of the surgical neck of the right humerus. Which of the following muscles is supplied by the nerve that is most likely damaged? Here are the answer choices. A. Teres minor. B. Teres major. C. Subscapularis. D. Infraspinatus. And E. Supraspinatus. Now take a moment to think of the answer on your own before we go through it together. Alright, let's tackle this question like we always do by reading the last sentence of the question first. And it reads, which of the following muscles is supplied by the nerve that is most likely damaged? Well, by reading this last sentence, we find out that it's not enough to be able to answer the actual question. We need to rely on the question stem as a whole. Next, let's try to figure out what subject are we talking about. Well, we're talking about nerves and muscles, the humerus, the arm. Well, it's going to be the topic of anatomy. And lastly, let's think about the patient and the chronicity of what we're talking about. It's a 60-year-old female who's coming to the emergency room after falling on her elbow. Well, it's an older patient who may be having fragile bones, difficulty seeing, and who's coming into the emergency room for an acute problem. And that helps us develop the clinical gestalt in our mind and imagine the patient as we think through this question. So, this is actually a two-step question of anatomy of the humerus. The first thing we need to do is determine which nerve was damaged as a consequence of the fracture of the neck, and then we'll figure out which muscle. So there are actually hints in the question stem. The first thing we need to do is recall that the musculocutaneous, axillary, radial, median, and ulnar nerves all originate from the cervical spine, from C5 to C8 and also T1. And all of these nerves pass over the glenohumeral joint and go down the humerus. Due to the anatomical configuration of the arm, a fracture of the surgical neck of the humerus results in damage mainly of the axillary nerve. Now that's really high yield. A fracture of the surgical neck of the humerus results in damage mainly to the axillary nerve. So our answer is likely to involve the axillary nerve. What we also need to know is that the axillary nerve provides sensation to the lateral side of the upper arm and shoulder. And this information is actually in the question stem and strengthens our argument that the axillary nerve is involved. Now the second step to this question is to recall that the muscles innervated by the axillary nerve that will result in the pathology we saw in the question stem. So let's look back to the question stem for clues. Recall that the axillary nerve provides sensation to the lateral portion of the upper arm and shoulder, and it only innervates two muscles, the deltoid muscle and the teres minor muscle. Another way to think about this is that the patient came in and said she couldn't raise her arm. Now think about it in clinic. When patients can't raise their arm, this implies damage to the deltoid muscle, which is innervated by the axillary nerve. Now, in this case, the answer to the question is going to either be deltoid or teres minor muscle. Looking at the answer choices, the only choice we have there is teres minor, and that's the correct answer, teres minor. Now let's go through high-yield facts for this question. The humerus is a long bone of the arm that attaches proximally to the shoulder at the glenohumeral joint and distally to two elbow joints, the humeral ulnar joint and the humeral radial joint. The humerus is more likely fractured at the surgical neck, and recall that the surgical neck is inferior to the anatomical neck. The axillary nerve is frequently damaged with a fracture of the humerus at the surgical neck, and the axillary nerve innervates the deltoid and teres minor muscles, which carry sensation from the lateral portion of the upper arm and shoulder. This region is also called the regimental badge area. Now also know that the posterior circumflex artery may also be damaged with these fractures. Now let's think about some of the other answer choices. The teres major muscle is innervated by the lower subscapular nerve, while the subscapularis muscle is innervated by both the lower and upper subscapular nerves. These nerves all stem from the posterior cord of the brachial plexus, and muscles they innervate control adduction and medial rotation of the arm. Now, the supraspinatus and infraspinatus muscles are both innervated by the subscapular nerve, which comes directly from C5 and C6 roots of the brachial plexus. The muscles here abduct the arm and laterally rotate the arm, respectively, while stabilizing the humerus.